let's start our webinar for today. So, once again, very good morning to all our friends who are joining us from North America. I know it's Thursday and it's a chilly morning today. So, thank you so much for sparing time and joining us for this second in series of webinars that Techugo is hosting. And our topic for today is we are discussing a very interesting topic. We are discussing something that has been affecting us throughout this year. And while we enter the holiday season and we end on a good note, we just wanted to give a chance and discuss about what technology is enabling in this space. So we are focusing today on mHealth and the topic decoding the next big what. We for our startups and entrepreneurs who are trying to make a mark in this space, we are trying to discuss the innovative opportunities, the various ways in which you can ride the tide, so to say, and create a unicorn in this particular space. Those are the opportunities and the innovations that we'll be talking about. So once again, thanks a lot for sparing your valuable time on a Thursday morning. To all our friends who are joining us from other parts of the world, you're welcome as well. As I said, the structure of our webinar for today would be, I'll spend approximately initially 30 to 40 minutes taking you through the slides, discussing about what are the various touch points, what mHealth has been, how it has evolved over a period of time. Then we'll very specifically focus on the opportunities that are there in this space as of today. From the perspective of whether you are a consumer who is looking to avail mHealth services, or be it from a provider or a regulator who is working in this particular space. We'll be talking about the various opportunities that are there to virtualize and digitize. And as we talk about opportunities, we see the various business models that we can explore with them, right? Because as a startup and as an entrepreneur, what you would like to see is, where is it that we can make a difference? That opportunity goes on and becomes a product or a service a later point of time if done well, right? So that's what we'll be discussing. What I would request you, I'm sure, and I appreciate, I want this particular session to be a very to and fro kind of a session. I'll keep asking few questions in between. Meanwhile, if you have any doubts, if you have sort of queries and questions about how to do something, please feel free to use the chat section. Once we are done going through all the slides and taking you through the entire piece of content, we'll have dedicated 15-20 minutes at the end of the session, which I'll use to basically answer the questions that you have. Okay, so let's begin. Now, talking about the evolution of health tech. Now, we all are aware that health tech as a term came at the end of probably in early 2000s, and from the early 2000s, the way we have seen the intervention of technology in the healthcare space, that has evolved over a period of time. And therefore, health tech as a concept has also evolved over time, right? So if I talk about the initial days, the early 2000s, when digitization had just started creeping into this particular segment, it was all focused about how I can make the task easier for a doctor. How can I make sure that the processes are digitized, right? This is talking about things like going paperless, reducing manual data entry, reducing redundancy so that I don't have to maintain those heaps of records of physical printed forms or paper or prescriptions that are written and historically maintain them. That was healthcare 1.0, right, initially. So it was to focus more on the operational aspect of healthcare. That means if I walk into a hospital or if I walk into a clinic, I go into a pharmacy, how structured can I make the operational process of it? That was healthcare 1.0. Then we started improving on that a bit from a technology perspective, right? We started talking about ERPs. That means how do you automate the entire workflows? So there came a time wherein everybody was riding this wave, wherein you go into a hospital, they have digitized the entire form filling process. You are capturing the data on a computer rather than capturing it in a form. You are maintaining emergency health records. You are maintaining patient health records so that when a doctor is addressing you, they already know your patient history, right? That was healthcare 2.0. And today, especially in the pre-COVID to a certain extent and the post-COVID era, this has been sort of a mini renaissance period in the space of health tech. What we are seeing is unprecedented in terms of the unique demands that are coming out of technology, in terms of the various use cases being enabled on the basis of technology, right? And mobility is right at the forefront of it. Because you see what happened with COVID, right? The level of interaction that we used to have with our doctors, with our paramedical staff, with anyone was suddenly stopped. From a one-to-one interaction, it moved to a remote interaction. No longer you were having access to that kind of one-to-one interactions with your doctors and your regulators, right? And that calls for a lot of innovation in technology. How can I provide a solution that can remotely enable the same experience? And that's where healthcare 3.0 is coming in. And today, while we know that we are coming in from a healthcare 1.0 and healthcare 2.0 kind of a legacy systems, our core focus will be to focus on opportunities and creating business models in the healthcare 3.0 space. With that being said, I quickly want to take you through, because mHealth as a topic or mHealth as a term is very, very vast, right? And there are a lot of, it's a very thin boundary between, if I talk about health, wellness, mHealth, then you have got diagnostic procedures. Now, what does all of this encompass? To put it very simply, if you had to think about mHealth as a concept, mHealth is nothing but extension of medical practice to the public using a mobile device. Now that mobile device can be a smartwatch, it can be your mobile phone, it can be the tablets, or so much so that it can be your bionic implants. So today, in today's date, what we are seeing is technology has reached a particular juncture and an inflection point wherein we have these implants that are going inside the body, or they are being used as patches on the body of the patients. They're capturing vital parameters and feeding it to the doctors. So anything that allows you to administer healthcare services, do monitoring, capture parameters, and work with your health parameters using a mobile as a front end, that is what encompasses mHealth. Right? So next time when someone asks you that, you know what, mHealth is just telemedicine, stop right there and tell them that no, mHealth encompasses a vast majority of products and services, and there are multiple touch points, and I'll be going through those touch points in details in our slides further. But to just think of mHealth as a live video consultation with your doctor it's like saying that I just covered 1% of mHealth. It's much more than that in terms of the opportunity, in terms of the various use cases that are enabled. It is much bigger, right? So just to see basically what it enables. Now, why exactly in healthcare 3.0 we are talking about mHealth? Why it has become so critical? Why the biggest organizations such as WHO are focusing too much of their funds, too much of their money to talk about mHealth as a component, as a component of providing future healthcare infrastructure services, right? The first thing, mHealth helps you in early diagnosis and better treatment. Now imagine a system which is there. Now we all know that we are inseparable from our mobiles today, right? There would be hardly a person, if you have 24 hours in a day, who would be without their mobile device for almost, I would say, 12 to 13 hours. It's always in the palm of our hands, or it is traveling with us, it is in our pockets, we are playing with it, we're interacting with it. The kind of data points that a mobile device can give you, it is in the form of a wearable, it is on your wrist, or if it is a patch, it is probably on your neck or on your hand if you are an athlete. The kind of data points and parameters that these mobile devices enable, all of them help you in preventive medicine. Preventive, we all know, right? It's a very common saying, prevention is better than cure. And nothing better than a mobile use case to enable that for preventive medicine. The data and the parameters that are being fed, if that is made available to you in a smart format, in an intuitive format that allows you to see decisions that what you're doing correct and what is going wrong, it basically helps you in early diagnosis as well as better treatment, right? Patients care for their own health and have a healthier lifestyle, because mHealth is not just about probably tracking your fitness data. It is much more beyond that, right? So it can be something about nutrition, it can be something about mental health. All those things create an impact. So what it does is it is giving you, it is nudging you. It's like having a coach in your hand that is nudging you to lead a healthier lifestyle. That is what mHealth is enabling today. And obviously increased prevention. Now, more efficient and sustainable healthcare. Now, a very easy way to understand this, especially in the scenario that we have faced right now, and this is global, right? We saw what happened with COVID-19. Countries with the best of medical infrastructure, so countries like Italy, countries like France, countries like the USA, which are at the forefront of health and medical infrastructure, it just crumpled down. It crumpled down in the sense that the pandemic had such a large volume of cases coming up. A normal infrastructure of healthcare is designed to only handle at max 10% of the capacity or 15% of the capacity. I guess if there is any problem, just do let me know, because I see that you guys, if you're not able to see me, just feel free to know me. There can be some technical glitches, but if you are not able to see me, just let me know. I'll continue with that. So we were talking about sustainable healthcare, right? So sustainable healthcare talks about how I am reducing the load out of my infrastructure. That means that if I allow remote healthcare monitoring, I see Virendra has raised a hand. Let me quickly check that. Perfect. Thank you so much for your messages, guys. Okay, so I'll continue from there. So we are talking about sustainable healthcare. So just imagine a scenario wherein people were able to extend remote healthcare services. Had our mHealth infrastructure been so strong, a lot of preventive care could have been given to COVID patients using remote healthcare, right? What it is enabling is, it is not forcing you to walk into a hospital to avail those healthcare services. You can do a lot of that while sitting at the comfort of your home. So that is how mHealth is enabling sustainable healthcare. You don't have to deal with a lot of travel. You don't have to deal with time being spent, a lot of resources which otherwise have to be kept in hospital to handle a certain patient load. That gets reduced. The size of the hospitals get reduced. The number of beds get reduced. All of that is adding to sustainable healthcare. And the last point here being, health professional could save a lot of time. A very, very important point to consider here. If as a doctor, if I today walk into a particular hospital, I see that if they have an 8-hour window, at max I'll be able to see probably 30 patients or 35 patients, because I have to give dedicated time to each and every one of them. What mHealth enabled was that scaled up that number by 1.5 times, 2x times, right? So I don't have so many people walking in. I'm not restricted by a geography. At any point of time, somebody wants to reach out to me, take a consultation or something like that, I'm able to process that on a remote device, right? That is something that has been enabled by mHealth. Just imagine how critical that is in a scenario such as COVID. A lot of our friends, a lot of you yourself would have availed these kind of services, right? And that is where a very interesting report came out in terms of what is happening in the post-COVID world. So in the post-COVID world, there is a company which all of us know about, Mckinsey. They did a report, they did a survey during the times of COVID across the globe, and they came up a few numbers that I'll be talking about in the later slides. But just before mHealth, I talked about the various use cases that they are enabling, right? That being said, let's just see what are the numbers and why we are talking talking so much about mHealth as a sector, mHealth as an opportunity, mHealth as something wherein there is a lot of unexplored opportunity to be there, right? Just imagine the number of apps that are there. Now, 325,000, those are the number of mHealth apps tagged as a mHealth category app on the App Store and on the Apple Store, right? Now just let that sink in. That means there are 325,000 solutions. Now we understand that a lot of them would be parallel and a lot of them would be overlapping, but the sheer number of solutions which are there just available on your mobile device today, catering to general solutions, general health issues, as well as niche health issues. Just see the number there. That's a large, that talks about the focus that entrepreneurs and startups have today in trying to create a difference in this particular segment. 80,000 publishers. So I'll just quickly take a minute to help you explain what exactly a publisher is. A publisher in this particular space refers to anyone who is creating an app and who is putting it out there for consumption on the Apple Store or on the Android Store, or making it available to be consumed on the tablet or probably the web browser as well, right? So publisher is someone, these are companies who have created these solutions and who are there, right, hustling and creating those kind of solutions that are making a difference. Let's talk downloads. Now, just the sheer number is something that should give you a sort of an awakening in terms of how many people are downloading health related apps on an yearly basis. This is a number which is published by Research to Guidance, a firm that specializes in mHealth research. They published this number for the year 2019, and this number I'm sure has, if not doubled, gone way beyond that, because with COVID happening, the maximum number of hits that we saw going in terms of Google queries or search queries on the web was for mHealth apps and preventive apps. 4 billion downloads out of a population of almost 8 billion people. If you see across the world, there are 4 billion downloads we are talking about. And the last point, which is the most interesting for all those startups and entrepreneurs, they're trying to make a difference. Just in the year 2019 alone, $8 billion worth of investments through venture capital was raised for startups in the health tech space. Now that's a large number. Just imagine if you can get even a smaller pie of the 8 billion investment. If you have that idea, what is the difference that you can make, right? So all of this is just talking about the kind of opportunity that is there in the market, the kind of acceptance that is there in the market. What you need is just that one idea that can create a difference. And if that is acceptable enough, if that is designed in a way that the consumer is readily accepting it, using it, seeing a difference being made with that solution of yours, I mean, sky is the limit, right? And that is what we are here to enable for you. This particular slide that I'm showing you right now on your screen is talking about the therapy market. Now, see this, of late, we are living a lifestyle. We call us the Gen Z, right? Or we call us the millennials. It is scientifically proven that the Gen Z and the millennials are suffering from lifestyle diseases. We don't have normal, we are not out there, we are not playing that much. So we are not getting diseases wherein you probably have a broken arm, or you have diseases where you get bruised, or those kind of, that is not something that is causing a majority of possibly fatalities today, right? The millennials are suffering from lifestyle diseases. These are diseases which are because of your health patterns, your health cycle, the way you live your life on a daily basis. A lot of us nowadays have a sedentary lifestyle, right? All of us are, and more so in the situation of COVID-19, we are restricted to a desk, as we are right now in this particular session, working 8 hours a day, 10 hours a day, sitting on that same table, stretching it out, no physical activity, a lot of stress in terms of There are uncertainties in the market, in the job market. So all of that is combining to create these lifestyle diseases, right? Just look at this particular slide on that I have put up. If you see all 5 diseases that we are talking about, these are all diseases that if you lead a healthy lifestyle, an active lifestyle, can be controlled. These are all preventive in nature. It's not that if you monitor them correctly, if you see them correctly, if you have the right set of tools and parameters that keep reminding you to be active, to follow your prescriptions, to not feel down, you can always come out of it. And that is where you should see, as a startup, as an entrepreneur, you should see an opportunity. Let's just take a few of them to understand. Cardiovascular diseases. What exactly causes cardiovascular diseases, right? One is either, for example, you don't exercise too much, or your eating habits. You're having a lot of fried stuff, or the way you consume is something which is not healthy. What exactly it takes to control that? Just a trigger that keeps telling you. Imagine you had a mobile app that keeps something which as simple as Healthify Me. We all know that it is or something like Noom. Noom has built its entire business model of nutrition on psychographics, and that is why they became so successful, right? Talk about one of the most popular startups that has come up in North America, Peloton. What did they do? They married hardware along with software. So when you are on your treadmill or when you are on your cross trainer, you have a screen which has an app that keeps giving you the key vital parameters, and that keeps motivating you to go further and live a healthy lifestyle. Let's talk about apps such as Calm or Curable. Curable is an app that has raised more than $40 million in funding. And what does Curable do? Scientific methods of removing chronic pain. You have an app called Calm, has raised more than $80 million of funding. Ways to calm down your mind, to live a stress-free life. That is, and these are all amplifications of lifestyle diseases, right? Stress, hypertension, and depression will lead to overeating. Overeating leads to obesity, diabetes, cardiovascular. It's a vicious circle. mHealth has an opportunity to break that circle. mHealth has an opportunity wherein it gives the control of your lifestyle, of your health in your hands. I'm not focusing very specifically on the fitness aspect of it because that's an entire different segment altogether. We have consciously tried to separate the health from the fitness, because fitness, the kind of things that you can do from a fitness perspective, that's a whole different market altogether. We very specifically want to concentrate on telehealth and on probably mental health use cases for now. But there is, as I said earlier as well, right? There is a very thin line, and you can keep dabbling between health and fitness. They can work together, they can work separately as well. But what I want to focus with this particular slide was that you have to understand it from an opportunity perspective, that what is it that we can create in this space. Let's quickly talk about the Mckinsey study, and you will just be startled by the numbers that you are seeing on your screen right now, right? What changed with COVID? McKinsey did this report in the time period of between March to July 2020, which was the peak period when the entire world was suffering through this pandemic, right? And they studied this entire acceptability of mHealth solution from the perspective of a consumer, from the perspective of a regulator, and from the perspective of a provider. These are the 3 main components who are affected by the case of COVID, and let's see what happened. From consumer perspective, while this data that McKinsey put out was from North America, but this can be extrapolated globally, because we know COVID-19 has an impact which has been equal across the globe, right? In the year 2019, just 11% of the people of the entire population were open to using telehealth services. That number has gone up, that acceptance has gone up to 76%. Now just imagine if out of 100 people earlier, only 11 people wanted telehealth, now 76 of them want it, right? Just see the opportunity. The current set of resources and the way exactly the current mHealth, even the solutions are designed, are not designed to handle that much load. So there is an opportunity right there from a consumer preference shift perspective, right? More than 70% of the in-person visits were cancelled. And this was a push that came in not just from a consumer standpoint, this is something that also came in from a provider standpoint. Because doctors, while they were the frontline workers, they are the one who were providing the services, they were the most exposed to getting infected. So when telehealth came in as providing a solution to these use cases, even the doctors prefer it. Doctors say that, you know what, earlier I would want someone to have a one-on-one interaction, but if it can be avoided, if it's just a routine general checkup, if that is something that I can do over a video call, why not? That acceptance increased. And while the acceptance has increased, sadly, the way we have our solutions designed today, they are not ready to handle that many load, that many use cases. I would want today to probably not just have a one-on-one session with my doctor, but them being able to probably, let's say, whiteboard on the mobile screen itself and explain the various issues that I might be facing, right? That is one use case. I'm not sure a lot of solutions would be providing that, but that's an opportunity. That's a use case. That's a differentiator that I can create in my product. So those are the things that we are talking about. So the consumer preference has changed, and that has created a big opportunity in this particular space. The similar thing is from a provider perspective. As I said, people are going in for telehealth appointments. People are going for virtual appointments. They want to be in touch more frequently with their doctor. They don't want to travel to their hospitals wherein they have their affiliations, but at the same time they want constant access to the doctor. Who can enable that? Remote healthcare can enable that. Mobile-led healthcare can enable that. Just see the numbers. The health systems have reported 50 to 175 times jump in the request for telehealth appointments, right? How do you handle that? How do you create a solution that is scalable enough that can handle such a load? Now, give them an option. Allow them to schedule, see the calendar, book the appointments. If your mobile app can do that, wherein I'm able to see that a particular doctor is available on a particular slot that is as per my liking. If I'm in the office and I can't travel to my doctor, but I always have the option to visit him at 8 o'clock in the evening, right? That is a flexibility that mHealth is providing me. And that is a flexibility that the doctor is getting so that he can handle much more number of patients without being able to be restricted at a particular place. So that acceptance changed from a provider perspective. So my consumer preference changed, my provider preference changed, and in turn, the third most important component, because we know that this space of healthcare, it is very tightly regulated. There are a lot of legal issues, compliance issues, regulatory issues that one has to take care of. Even when we talk technology, right? How the data of the customers is being handled. To what level I can share data, I cannot share data, I can play around with the patient records available. That is something that the regulatory body is now much more opened up to. So if I talk about CMS, the Center for Medicare and Medicaid Services, within a span of 3 months, they went ahead and approved 80 such services, 80 new services. A lot of them, if I talk in technical terms, was data being made available to be consumed by technology platforms so that they can use that data to spread information, to spread knowledge about diseases, and all of this was used by platforms and consumed by platforms in a way to make their customers aware about what's available, right? So the regulator has opened up. Typically, a new service used to take an easy 9-month cycle, 1.5 year cycle to get approval. They understand the relevance, they understand the crisis that we are in, and they have gone ahead and they are approving these services. So now is the right time. If you have an idea that you think, okay, you know what, this might have some regulatory barriers. Now is the time that everyone is talking. Now is the time when, even if it's something that can create an immediate relief, an immediate difference, you might go ahead and you can risk it and you can get an approval for that, right? So the regulatory bodies are open. And with these three people coming in together, the consumer, the provider, and the regulatory. All three are open to telehealth. So with that being said, just try and imagine if you have a solution that fits all these three parameters perfectly, the kind of impact that your product can create or the kind of impact that your service can create. Just see that and visualize that from an opportunity perspective. Continuing in the same thread, what McKinsey did was they said that let us realize that in our 1.2 trillion healthcare infrastructure, what is the virtualization opportunity that I'm seeing today? They said that almost $250 billion worth of existing Medicare. Medicare basically includes your emergency health services, your telehealth services. Medicaid is your any surgical services or medicines. You have your commercial outpatient OP, which is people walking into the hospitals for their appointments. $250 billion worth of business can be virtualized. So the graph is depicting the same, that the total healthcare opportunity right now is $1.2 trillion, out of which roughly 80% is non-virtualizable. So we don't take care of that. We leave that 1,000 or $1 billion separately, but the remaining $250 billion that we have, right? There is tremendous opportunity there to virtualize. There is tremendous opportunity there to create solutions that will allow cost savings. While it is cost savings on the healthcare infrastructure perspective, for someone who is a startup or someone who is an entrepreneur, it is creating that business opportunity. It is providing that alternative to the healthcare infrastructure, and that is where you should see a revenue opportunity being created for you. Now let's quickly go and talk about the opportunity model. So when I say the opportunity model, use this as a tool to see if you have an idea as a startup or as a tech company, if you have an idea, which is the space that you would want to dabble with, right? So we have innovative technology. I have talked about the various things. I've talked about implantables. I have talked about smartwatches, apps, health, nutrition, mental wellness. Now, all of this can be enabled with technology, right? But what is it, the problem that you are trying to solve? That is the most critical component as a startup or as an entrepreneur that you need to sort in your business model, saying that this is what I'm trying to solve. Am I trying to improve experience and access of the patients or the customers? If you're doing that, telemedicine is something that you can dabble with as an area to operate with, right? If you're trying to improve the experience, if you're trying to improve the access, talk about preventive care. Preventive care improves access to basically tons of validated medical information to the customers, which is true, which is trustworthy, which they can basically employ while they are being at home. So it is improving access of yours. You don't need to go to a particular doctor to access those services, those informations, those knowledge that is already available to you. So while you are at home, you can do a lot of preventive care. And we saw that happening during the times of COVID, right? The second pillar would be improving health. How do we improve health? Two things: do remote monitoring and do big data and health analytics. We talk about health organizations, we talk about hospitals, we talk about clinics and pharmacies. They are dealing with tons and tons of customer data. How smartly you analyze this data. If you want to dabble in that space, that you want to find particular trends, if you want to use the available data to create a sort of framework or infrastructure that can help improve the health services, now that is one space that you can dabble. That is one space wherein in the mHealth space you can create a difference, right? So while we, as I said, don't see mHealth only as a doctor-patient relationship solution. There are tons of different things that can be done on the doctor side, on the consumer side, on the hospital side, and as well as on the regulatory side. All of that will be encompassed in mHealth. Reduce cost. When will your business become successful? Your business becomes successful if you are giving probably cost savings, or you are doing something much more efficiently than how it is being done already, right? So for example, self-diagnostics. emergency health response, reaching out to your customers via email, text, social media, probably through live chats, through push notifications. Now, when you have changed the medium of communication, that all of this can be enabled using a mobile infrastructure. There is no need to travel. There is no need to move around places to access that information. So you are reducing that cost. So work around these three pillars and see where exactly your opportunity fits. It need not be one of them. It can be a mixture of improving experience and reducing cost. It can be a mixture of improving health as well as access, or it can be a combination of all three. So when you are evaluating your business model, when you are evaluating that what is the value proposition that my product is giving, always keep an eye for this opportunity model. It will help clear out that value proposition that you are trying to build into your product, right? Now, just to talk about, since a lot of people relate to mHealth from a hospital doctor patient standpoint, I want to just give you an example of what are the various opportunities that we see in a hospital. While we are just talking about few of them, just 8 of them right now, there are much more opportunities that can be envisaged, and that is where you create a difference, right? So in this slide, I'm just talking about the opportunities that you might not have thought of can be made available in a virtualized manner. Think about pre-registration and registration apps. Apps that allow you to create an account within a hospital without even walking in and doing in your registration. Think about patient education and wellness apps, wherein you tell the patients you give them about Medicare, their rights, how they can avail insurance, what is included in health and wellness, what are the offerings, all of that you can make through patient education and wellness apps. On the doctor side, procedural explainer demos for doctors. Now, doctors on a daily basis are dealing with a lot of content, not only the knowledge in terms of, because every day something new is coming up. You have new devices, you have new surgical implants, you have new procedures that are being carried across the world, and they would want to know how exactly it is being done. And technology is making a difference there, right? You have these explainer demos of how to use devices. You have these live recordings or live feeds of any surgical procedure being done that is available on a mobile device in a recorded manner. See that as an opportunity. If that is something that you want to create as a niche solution, that is your opportunity right there. Patient portal apps. A lot of companies have a very regulated insurance structure wherein whatever you spend, you are able to claim that through your insurance. If you have a patient portal app through which you can basically access your Medicaid and insurance services or MediInsure services, that is an opportunity that you can create within a hospital for all the affiliated insurance providers. Then apps to engage patient during wait times. People are sitting across a big hospital or a clinic. While they are waiting, you can engage them, you can talk to them, provide them their previous historical data of what their prescription was, what is the improvement they have made, talk about the new, or probably any informative content, right? If there is a flu season, what's the benefit of a flu shot, anything that keeps them engaged while they are waiting, anything that can provide information, that's an opportunity. Apps to explain pain areas. We always know that what we see is what we believe, right? So instead of a doctor telling me that you have a problem in this part of the kidney, which I probably cannot see because I've never seen a kidney as a patient, if I have an explainer video, if I have a tablet that basically has a 3D rotation model which can explain me, okay, this is the part that is getting affected. This is what I need to take care of. This is the difference between a healthy kidney versus something a troubled kidney, right? That helps me get a much more impactful knowledge of what is working and what is not working, right? Medication reminders, those can be an app. Bedside care apps for people who cannot move, just give them the reminders of their pills, all the information being available to them, when do they have to take what type of food, whether it is something that has medication that has to be taken before or after food, when they're due for their next doctor visit, especially in old healthcare, managing healthcare for older people, these kind of apps become important. So we just saw 8 different opportunities being created within the hospital itself, and there are much more beyond these, right? So once you start thinking, and once you start thinking on those lines, that is something that can be enabled. And there are tons and tons of different opportunities. So in the previous slide, I talked very specifically to use cases that you can create in a hospital. Now I'll be talking about what is it for the consumers. Just see the number of opportunities that we are talking about. And the reason why I'm focusing so much on the opportunity and the innovation is because a lot of us are programmed to think that mHealth is just live chat with our doctors. mHealth is much, much more beyond that. mHealth is enabling use cases much beyond that, right? So if I think from a consumer perspective, just see the tons of opportunity models which are available there. I showed you the opportunity model earlier. Pick up these services, and there are already players trying to solve a problem in any of these particular segments. So whether for a consumer standpoint, whether it's education, whether it's chronic disease management, I gave you an example of Curable as a platform. Mental health, I gave you an example of Calm. Self-monitoring, you have got an Apple Watch today on your wrist. The hardware has taken so much strides, it is able to capture your health parameters in the form of your ECG. It is helping save lives. It is capturing your sleep patterns. It is capturing your blood oxygen levels after a healthy exercise regimen that you do. All of these are opportunities. See what is the difference. If you can probably create, now business models are built around it, right? So for example, what did Peloton do, or what did an app like Noom did? They just use these set of information and tools available, and with this they created a unique value proposition for their customers, and that resulted in people sticking to their platforms. This is what Under Armour did. This is what Nike did when they had the Nike shoes that with a chip that could capture your running data, the way you run, what is the load on your legs, which part of the leg is whether it's inside or outside, and depending on that you design running shoes as per your own style of running, right? So the opportunities are, you can target very, very niche businesses. Women's health, a lot of women's health is something that has tremendous opportunities today because women as a gender, they have specific cycles throughout their lifestyle that they go through, whether it's through the initial puberty stage to the time when they go to their sexual health and wellness. There are apps, there are companies that are targeting specific segments and niche segments and creating a solution for that. That's a very unexplored segment that can be taken care of. And then we go to the professionals, right? What is it for the professionals, or what is it for the doctors that you can create as an opportunity? Just see the amount of opportunities available there. You can talk about disease diagnosis, you can talk about drug reference databases, you can create something in hospital information systems. There is telehealth, again, which is common to both consumers and professionals, but you can have appointments in clinical assistance. You can create professional networking platforms specifically for doctors. So for example, a pediatrician who is there in the USA would want to exchange notes with someone who is in a country like India or who is in Saudi Arabia and exchange notes on the best practices. If that is a platform that can be created, that's an opportunity right there, right? Imagine it to be a social media network for health professionals, something like that. It can be a marketplace wherein there are clinics or there are pharmacies providing services and there are people seeking those services. All of them come onto a popular platform and they can find or explore each other. That can be a P2P model that you can explore. So in a nutshell, what I'm trying to say is the avenues are much. Only thing is you need to find that particular niche that you're trying to solve in this sector. And we are here to help. So if you have one particular idea in your mind that you're trying to validate in this space, please feel free. We are always there to help validate that with our expertise, with our experience. We can help enable that, right? A very, very interesting slide, and one of the most interesting slides that you would want to understand if you are a startup or if you are someone who's trying to create a solution. Because at the end of the day, I am a business, right? How is it that I can create money out of these models? This is something that will interest every startup, every entrepreneur. Now, how do I do that? Typical licensing model. You have created a solution. It can be a software as a service kind of solution, or just a solution that is available on the web and mobile, and you sell it out to institutions as a white labeled platform. You tell them that, okay, I have created, for example, a hospital information system. That is something that I can label it as your hospital's information system, and I give it out to you. If you have 100 users using this platform, pay me for those many licenses. That is a monetization model for your product or service that you create. Typical service sales model, which is software as a service model. I have created a platform that allows remote consulting, that allows telemedicine to be provided, all those services. If I'm a doctor, I'm a clinic, I register on the platform and I provide my services for which I charge a certain amount. A particular commission of that part goes to the platform owner or someone who has created the platform, right? This can be a solution also for standalone businesses. If my entire business is built on that particular model, all the revenue is controlled. So for example, if a doctor owns this platform and is providing live consultation services, the proceeds of whatever revenue they generate goes completely to that particular doctor, right? Content, a very underrated but a very strong way to generate revenue. Medical information or medical knowledge, it has to be trustworthy, it has to be validated, it has to be accurate, right? The more accurate and the more validated the information is, the more is its value. Think about a platform which uses artificial intelligence to curate globally best health practices or the best or the latest in research, and it feeds it to you on a daily basis depending your health condition. Now, anybody would want to pay a little bit of amount and consume that premium content, right? That is one monetization model that you can think of. So it can also be in the form of a freemium model. So you have designed an application wherein you are giving some basic health and fitness features, but if you also want to have premium content coming in from nutritionists, dietitians, alternative medicine, alternative therapy, validated content, all of that can be monetized. So content has a very big play in this particular monetization model. So think about building that piece into your business model. Then you have advertising. As I talked about earlier, if it is a P2P marketplace wherein there are just the consumers and the suppliers available on the platform, they might do the transaction out of the platform. You are just allowing them to connect there. But since you have so much traffic of users coming onto your platform, you can always use to build your advertisements and sponsored listings onto that platform, right? And that is how you generate advertising revenue. And the last being the actual transactions. So imagine you are in the mHealth space and you have created an e-pharmacy. So you are selling basically medications, the over-the-counter medications on your platform. You are selling insurance services on your platform, health insurance services, all of that. For every transaction you get paid. So there is a certain commission that you build in depending on the kind of services that you're selling, and that helps create revenue for your platform. So the opportunities are immense. Again, it's not a single way of making money. It can be a combination of all of them or a few of them. What you have to see is what exactly fits the bill in terms of what is the value that you are providing to your customers, right? And we can help decide this monetization models for you. We can create these monetization models on your app. We can consult on that and we can create it, right? So that's how you create the differentiation. And coming towards the last leg of this particular webinar for today, how can Techugo help you, right? What is it that we do that can help create that next mHealth unicorn or that next tech unicorn? So as you all know, Techugo is a company that has been dabbling in the space of mobile and web app development for a period of more than 8 years now. Overall, during this period, we have worked across mHealth verticals and the various use cases that we spoke about. We have a very deep understanding expertise from a technology standpoint as well as from a strategy standpoint as to what is it that is being there asked in the market, how to go ahead and develop that, right? So what do we provide you? We provide you with these few services that can help you take that first step towards creating that startup or that business of yours. So we do one-on-one consultations on what is your app strategy, what should be your platform selection, how do you roll out your app, how do you plan that app. So we do one-on-one consultation sessions. Along with that, we also do your planning of your statement of work, right? So depending on what's your business model, what is the solution that you're trying to create, what is the audience that you're trying to work with, we help plan your ideal customer journey, that what will be their touch points, how would they interact with the app, what are the data points that are being captured, created, provided, what are the dashboards and stuff like that. So the entire design of the workflow is something that we do free of cost for all our customers who work with us. Apart from that, if you are someone who is right now a fence sitter, that means you have not taken a plunge and you are thinking, you have doubts about what is it that will work for me. Is it something that I'll be able to generate enough funding to create? How do I go about doing it? How do I test my users? How do I visualize what I'm trying to create, right? For them, we have something as a concept that we have developed called as a concept analysis workshop. It's a paid workshop that we do with you. Let me quickly take this slide and I'll explain it to you what exactly is a concept analysis workshop. So this is something that we have been doing for the past 3 years with a lot of our customers, and concept analysis workshops have gone ahead and resulted in full-fledged products because these customers have worked with us over a period of 2.5 months. Now there are two things, right? And if we talk about the business space, there is an MVP, which is a minimal viable product that you do if you already know the segment, if you know what you are trying to create, what is the feature that you're trying to test, you have a very decent idea. So in a later stage of the product development that you have got your business model sorted out, you go in and you develop an MVP. That is where we come and help. We say that, okay, this is your technical specification, this is how you want your app to look like, this is what your design is. We go ahead and code that for you. That's one way of doing it. But there are a lot of startups and entrepreneurs who are at a much earlier stage. They are still in the conception stage of their business idea, right? And that is where the concept analysis workshop comes in. In concept analysis workshop, we create the entire end-to-end flow at roughly 5% of the cost of your total budget. So let's say your MVP, if it would have costed, for example, $100,000, you can get the same concept validated and presented to your venture capital or to investors at roughly 5% of the cost, which is roughly $5,000. Now, what do you get in a concept analysis workshop, right? You get your designing, you get your branding, you get your UI, UX, you get your clickable prototypes, end-to-end flow. That means we'll design how exactly your app will look like. You can click and navigate as if you were using those features in a real world app. So it's a complete experience of using your app. What it helps is it shows the investors the value that your app can create. At the same time, you get a direct feedback from them that what will work and what doesn't work. So without investing that much capital, at 5% of the cost, you have validated the idea. You have a pitch that you can go and speak to your customers. You can gather the feedback. So it's like failing fast, pivoting and improving rather than investing something and getting stuck at an MVP level. Right? So concept analysis workshop is one of our most successful programs that we run here at Techugo. That is something that we would love a lot of you who are in this space, who are trying to create that difference. If you want, please get in touch with us. Our email ID is sales@techugo.com. Feel free to drop in a text to us. You can visit our website, reach out to us through our website. We'll be more than happy to book a session with you, and we'll be able to help you basically answer all the questions and queries that you have. With that being said, I thank you. I understand that I have exceeded my time with a little bit, but we still have few minutes. So I'll quickly take those minutes to see the kind of questions that we might have. Okay, so there is a question that I see that is coming in from Hannah saying, how many different type of use cases can be there in the mHealth space? Again, I'll take you back to that particular slide that we initially discussed about, wherein I was talking about the opportunity model and I was talking about what are the opportunities from the consumers as well as the provider space. What we'll do is we'll try and make this recording of this particular webinar available for you, so you can go back and cross-reference that for understanding the opportunity model. I see a question coming in from Mark which says, how do I plan the financials for my health startup? Okay, very interesting questions. What are the considerations? So I always tell our customers that whenever you are planning an app, right, divide it typically into 3 phases. You have a pre-develop phase, you have a development cost, and the post-development cost. These are the 3 things that you have to be taking care of. What is your pre-development? Your pre-development is when you do the market research. Your pre-development is when you are validating the idea. See, understand this as a very core thing. It is not the technology that makes a difference. Technology is very standard, and the execution is something that if it's a difference of 1920. While there are differences, an experienced company can do a much better work. I would say the core is the idea. So if your idea is unique, if your idea has acceptability, technology will enable that and bring the best out, right? So in the pre-development phase, always think about doing your market research, getting your initial feedback. And that is where we said that the concept analysis workshop makes a huge difference. It helps you validate your idea, it helps you see value, it helps you plan the roadmap of how your features will start rolling out. Your customers don't want 20 features at once. They want 5 features, but those 5 features they should be able to use on a daily basis, right? What are those 5 features that will create the stickiness in the platform? That is the most critical component that one should think about when you are designing. So you have a pre-development phase wherein you do the concept analysis workshop, you are ready with your market research, you validate your business idea, then you take care of the development costs. So development cost is, again, it's a choice of platform, it's a choice of technologies, whether you're trying to go Android, you're trying to create for iOS, do you want tablet support or not, do you even need a mobile app, or if it is something that can be delivered through a web platform, we consult you on that as well. Once you're done with the development piece of it, the last piece is you have to also keep a budget, because you are jumping in a pool which is already having certain players, right? How do you communicate your USP? So always think about a marketing budget. Always believe that if you have a, let's say, a 3-month or a 4-month development cycle, you should start hitting the market and letting people know that you are coming, and you are coming there to create a difference probably 1 month before the launch. Create that buzz. So you have to think about financial consideration from a marketing perspective. How would you promote it on the app store? How would you promote it on the website? How do you create a pull of the initial set of daily active and monthly active users, whether you give them for a free trial or you use a freemium model? All those considerations come in. So when we do the concept analysis workshop with you, we help you plan the 3 stages of this app so that you can plan the unit economics of what exactly that you are looking from a funding perspective as well, right? If you get that sorted in the analysis workshop itself, it gives you clarity that for the next 1 year or 2 years, what your financials are looking at. So that is how we control it. Now, let me quickly check if we have some more questions. Okay, just give me a moment, guys. So let me go one by one. I won't take a lot of time. So Brendan asked that I have an idea. How do I validate and start building, right? Just reach out to us. Start speaking to us. Let's start building upon your idea. Let's see what is exactly that you're trying to create. And then from a consultation workshop, you will basically get to know what is it that you are seeing. Is that certainly making difference, or there is a other way of doing it? When we go into a brainstorming session, we share our experiences and we always ask you, have you considered this? right? That's the value add that we do. So from our expertise, from our experience of creating similar apps earlier, we help let you know that, okay, this is something that you have thought, okay, and this is how it can be improved much further, Brandon. So please feel free to reach out. We'll be more than happy to help you validate your idea. Mark, how do I plan financials? I have already answered that question. Then Case has asked, how much is the range of prices for your products? Okay, so Case, to answer that question, we are in the bespoke mobility solution business. So when I say bespoke, it's like getting something made to custom order, right? So your idea might be very different from someone else's idea. So when I say that, I can't put a price to it in the sense that I don't know what it is that you're trying to create, right? So when we get onto our one-to-one consultation sessions, we validate the idea, we understand what effort it would take, what set of technologies, what approach would it take to build the kind of solution that you're looking for. And once we have got that logged in, that is when we are able to tell you an estimate of, you know what, for creating this is the timeline that you should be working with, and this would be the probable cost that you should be working with. So that's how we build the cost for you, right? So please feel free. We are there. Just drop in an email to us or visit our website. We'll be more than happy to let you know what exactly your idea is and a cost for that as well. Okay, so I have seen Case has sent an email ID. Sure, Case, we'll work out to you. We'll reach out to you. We'll catch up on what is the ideal choice of platforms. Okay, so Dave asks, what is the ideal choice of platforms for my mHealth app? Just to give you an idea, right? The choice of platforms varies depending, as I said, varies on what, if you are an informative platform, someone who is just, let's say we are talking about a segment that was just sharing information, right? You can start with even a website that is mobile responsive, because the platform is meant to share information and disseminate information. So even a mobile app that works, a web app that works on the mobile will do for you. However, if you are a platform which requires, let's say, live consultation, speaking to the telehealth, or if it is a fitness app with a wearable play, then you have to create an app that uses the hardware capabilities of the mobile device. So it has to be written in native. So if it is written on Android, it has to be written probably in Java or Kotlin. Or if it has to be written on Apple, they have specific languages, Swift, C. That's the technology that we use. Or again, it depends on if you want to write single piece of code, and if you want to go for ease of maintenance, we support cross-platform apps. So whether it's Xamarin, whether it's React Native, whether it's Flutter, all of that depends on many factors, right? So once we understand the business model, that's when we propose the entire architecture and the scalability, what cloud to use, and everything that comes as part of our consultation workshop. So with that being said, I think we have answered a lot of the questions. We are stretching a little bit over our planned time, so we have already hit our 1 hour mark. So if we don't have any more questions, I would like to once again thank all of you for making the session today. Please feel free to let us know on our website. Just come and give us our feedbacks. You all have our email IDs that have come to you through our the invites that were sent to you. Please feel free to let us know what is it that you liked in the webinar, what is it that you would want us to cover in the next webinar. If there is a certain topic that you wish that we should cover in our next webinar that will be planned in a fortnight's time, just feel free to let us know and we'll try and see if we can cover that. With that being said, thanks a lot guys again for your time. Have a lovely day ahead. And happy holidays. We know that in North America we're getting into the holiday season, so happy holidays to each and every one of you, and we'll see you on the other side in the new year. Thank you so much for your time. Have a lovely one.